we touched on this a little bit last week. It is an ongoing story. The Affordable Care Act, in many respects, is a mess. Obviously, it's working great. And one of the stories that seems to be emerging is there has been a tremendous amount of people who have signed up for the expansion of Medicaid in those states where governors have allowed it to expand. And that is very encouraging in terms of bringing more people into the system. Poor people, people living in up to 133% of poverty, at least in those states that have allowed for it, entering into the system. But what I'm also encouraged by is that we're seeing more aggressiveness, at least in the pundit class, about trying to say, the solution here, or at least the reaction from the left, should begin to more aggressively push for a more liberal version of healthcare, of health insurance, because the problems that we're seeing associated with this are all a function of the neoliberal, the market-based policies that are embedded in the Affordable Care Act.
Yeah, I mean, look, we did talk about this somewhat last week, and the biggest, talk about something that's sort of a microcosm of what's been the larger problem during this entire presidency of Barack Obama, which is, in the end, you allow the more conservative voices in your own party to weaken the bill with, weaken whatever it is you're doing with their neoliberal changes, and then you weaken things even further, trying to get Republican votes that you never end up getting. It's also because you're scared of actually people saying you're a big government liberal, which is, by the way, a very popular position these days, not what it was 10 or 20 years ago. And so you do this, and it becomes a self-fulfilling prophecy. It was like when he cut the stimulus down and added a lot and larded it up with tax cuts and got virtually no Republican votes. And in the end, the stimulus hasn't performed as well as it could have. And what's been the result of that? That is the problem here. Okay, so fine, that's history. We can't do anything about that anymore. But Alex Perrine had a great piece on this, and others have written about this. It needs to be fixed, and that's what every Democrat running in 2014. They used to run on Social Security Plus. Maybe it should be Obamacare Plus. I don't know, but it should certainly be. We're going to reform and fix Obamacare. To better provide you with services or whatever it is. They'll come up with their lines for it. But I think part of it should be what has not happened in the past. Run on the public option, adding that to this thing. Run on lowering the Medicare age or Medicare for all.
Yep. Federalized Medicaid is also a great idea so that we don't have to deal with, if the feds are already paying for 100% of this thing for at least the next 3 years, and then are looking only for 10% from the states, to federalize the whole program. I think we had an email about that as well. That is a huge problem, is that we're allowing the states to have their way with these programs, and its effectiveness is a function of do you have a state that has regressive local politics, frankly?
That's right. That's caused a lot of these problems. It's hurt the exchanges because more people were thrown into the federal one than was ever expected before the Roberts Court said that these people didn't have to accept Medicaid in different states. Federalize Medicaid. Everything when it is federalized works better. It just is that simple. Do not fall for the garbage we've been fed the last 30 years, how corporations are more efficient and all. Because and the states are more efficient. They're hugely efficient at suppressing people's civil rights, I guess, if you like the states. And corporations have been great at overcharging people and giving them a crappy product like healthcare companies. But otherwise, guess what? Standardized, well-researched, well-run programs from the federal government like Medicare, and Social Security and veterans programs and others are the best working programs.
And what I think we're going to see just from a sort of a media narrative is that we're already starting to see the debunking of a lot of the big stories we're seeing in terms of my insurance got cut. Now, the reality is that, one, the vast majority of these policies, it certainly wasn't, you've got policies that, first off, a lot of these policies are being canceled because they don't meet the minimum standards. we're seeing story after story now where we're getting, these people are saying like my policy it doubled, and I don't have the same I had a catastrophic policy, and my policy is doubled. But in fact, as reporters start to catch up on this stuff, they're starting to realize, like, hey, wait a second, you didn't actually check to see if you could get a similar policy. What? Let me put it this way. What we're seeing is these insurance companies saying your policy's been canceled. They try and upsell to a nicer policy. I can't remember who it was that wrote about it in this way. I think it was maybe it was Michael Hitzik, or it was Kevin Drum, or
I've read,
Paul
whatever it is.
Waldman.
I've seen all those. Obviously, I've seen all those stories too. And then there's just people that obviously they want to, which is a lot of those voices out there, just want to destroy. Have wanted to destroy this healthcare program from the beginning, and are still dedicated to it. So you'll have people invited on Fox News to tell their terrible horror stories, and then when anybody does any research into them, finds out that they're all bogus.
And we should also point out, it is not, look, even if your policy does not meet the minimum standard, you still, the insurance company could continue to offer it for another year. But they're not,
right,
because no one's signing up for those policies because they don't meet the minimum standard. And so this is a business decision by the insurance companies. Now, of course, I find it hard to believe that the Obama administration, and in fact, they did know this, and I think you could see stories, didn't know that the insurance companies would react this way. And so for all intents and purposes, President Obama's pledge was, if not a lie, then just a gross misstatement of what was obviously going to happen. But that said, the amount of people that this impacts is far smaller than what we are led to believe by the media coverage. And the implications for those people is also far less onerous than what we've seen. And the idea that, look, we hear people complaining like maternity care. How could you force people to have maternity care? I don't know. How could you force women to have policies that pay for Viagra? How could you have women, have to pay for prostate exams? I mean,
but you don't understand, Sam. It's white men who are complaining about this. So obviously, everyone should have to cover Viagra because that's what they need.
Yes, well,
they're old and they're old and their penises don't work.
That's right, and
what are you thinking?
It's only straight men who take Viagra, so this is really providing a service for the ladies.
That's right.
I mean,
poor
it's
women out
absurd.
there saying to themselves, "I wish I could have myself a fat 65-year-old grit-swigging teabagger," and with Viagra they can get that. So obviously, it does help the ladies.